Hello, my name is Lauren Wren, and I'm the Safety and Wellness Coordinator and Credentialed School Nurse with the Safety and Wellness Department at Imperial County Office of Education. We at ICOE believe in ensuring that our schools have the tools to prepare and to respond to emergencies. In response to an increase in opioid overdoses across the nation, we've prepared this training to educate school staff on how to administer the life-saving medication Naloxone. Naloxone is the first-line treatment for opioid overdoses. What are opioids? Let's take a look at what opioids are and what puts people at risk for overdose. Opioids are a class of medications derived from the poppy plant, typically used to treat pain. Some of the most common forms include prescription medication like oxycodone, hydrocodone, morphine, codeine, as well as illicit drugs such as heroin and manufactured fentanyl. When opioids are taken in excess, whether accidental or purposefully, or if pills or substances are laced with stronger opioids like fentanyl, an overdose can occur. An opioid overdose causes respiratory depression or reduced respiratory function, resulting in decreased levels of oxygen in the body. When breathing stops, the lack of oxygen can cause brain damage and lead to death without intervention. What is naloxone? Naloxone is a safe, effective, and easy-to-use medication. It is an opioid antagonist or blocker which can reverse an opioid overdose quickly. Naloxone is non-addictive and cannot cause harm, including those that are not experiencing an opioid overdose. Naloxone comes in a few different forms, but schools will have access to the brand name Narcan nasal spray. You'll want to familiarize yourself with where the naloxone is at your site in case of an emergency. Naloxone should be stored in an easily accessible area and should be kept in conditions between 59 to 86 degrees Fahrenheit and out of direct sunlight. So now that you know what naloxone is, let's talk about when and how to administer it. You'll want to remember the 4 R's in naloxone administration: recognize, respond, reverse, and refer. Recognize. The first step is to recognize the symptoms of an opioid overdose. It's important to note that the difference between someone who is sedated or high on opioids and someone that is experiencing an opioid overdose. Someone that is high or sedated after using opioids may have relaxed muscles, have slow, slurred speech or breathing. They may appear sleepy or nod off, but will respond to stimuli like a sternal rub, yelling their name, or a pinch. In an opioid overdose, you may notice some or all of the following: deep snoring, gurgling, or wheezing, changes to the skin tone like a blue or gray tinge to the lips or fingertips, pale, clammy skin. They may have a faint pulse. The person will not respond to stimulation, and the breathing has slowed or stopped. This is an emergency. Respond. If you recognize a confirmed or possible opioid overdose, immediately call 911 or direct someone to call 911 and retrieve the AED and naloxone. Provide rescue breaths if needed. You may need to perform CPR if the person's heart stops, so be prepared to render aid. Lay the person on their back if they are not already. Reverse. Let's prepare to give the naloxone. Remove the naloxone from the box and peel back the tab with the circle to open. Hold the naloxone with your thumb on the bottom of the red plunger and your first and middle fingers on either side of the nozzle. Do not prime or test the nasal spray. It contains a single dose of naloxone and cannot be reused. Gently insert the tip of the nozzle into either nostril. Tilt the person's head back to provide support under the neck with your hand. Next, move the person into the recovery position by turning them on their side with their hand supporting their head and their top leg bent to stop the body from rolling onto the stomach. If the person does not respond by waking up or breathing normally, another dose may be given after 2 to 3 minutes. If needed, repeat your actions by using a new naloxone spray to give the additional dose in the other nostril. Continue to care for the person until EMS arrives. When EMS arrives, answer their questions and provide the following information: the victim's name if known, any known medical problems, allergies, or medical history, the time the victim was found and what action was taken, the initial and current condition of the victim, including the time naloxone was administered and how many doses were provided. Be sure to assist as requested by EMS providers. Refer. Have the individual transported to the nearest medical facility, even if symptoms seem to get better. Some opioids last longer in a person's system than naloxone. This puts them at risk for overdosing again, and they may require additional care. If a student was the victim, contact the parent or guardian per school protocol in coordination with your administrators. Any individual who experiences a drug overdose should be referred to a drug counseling program as appropriate. Be sure to follow your district's documentation practices to log information about the incident. Notify your administrators that the naloxone will need to be replaced. Naloxone should be restocked as soon as possible, but no longer than 2 weeks after use. With the completion of this training, you are now equipped with the information you need to administer naloxone in the event of an opioid overdose emergency. Thank you for your time and commitment to ensuring that you're properly trained to save a life from an opioid overdose.